What do you think that OBGYN teaches medical students that you wish every doctor or future doctor knew?
Listen to women.
Hi, this is Dr. Katie Patel, and this is your OBGYN colleague consult.
Leah, thank you so much for taking the time out of your morning to talk with me today.
Hi, I'm Dr. Leah Roberts. I am a reproductive endocrinologist. So my journey was very interesting. I trained up in Philadelphia at Temple University Hospital in OBGYN. During my time there, I did apply for fellowship in reproductive endocrinology and infertility. And unfortunately, I didn't match. So this is to tell you that even if you don't match where you want to initially, there is definitely a reason to persevere and keep pursuing your goals. I was working with my former co-residents in North Philly. Then a spot opened up in my dream fellowship at Reproductive Medicine Associates of New Jersey. So sometimes the things that seem like the worst thing to ever happen to you can really be a blessing in disguise. It was there that I actually met my current partner, Dr. Margolis. I loved my time doing obstetrics. I love gynecology. I love operating, but mostly I just love getting people pregnant.
What do you think a student could do rotating with either a general OBGYN or even with you in the subspecialty? How can they stand out to you? How can they impress you?
Absolutely. So here's the number one thing. Whether you think that you are going into obstetrics or going into something else, you will always deal with women, and most likely will deal with women of childbearing age at some point. So my goal for my students with the clerkship is to figure out what is normal and abnormal, because at some point you will be calling OB for a consult. The thing that would impress me the most as a general OB is when you are assigned to a patient, being really engaged with that specific patient, get to know the patient, hold their hand during labor, really be involved. At some point, you are going to feel like you're in the way. That is normal. Obstetrics can be a high risk experience.
Mhm.
And there's going to be a time when there's an emergency, they need to rush back for a C-section, there's a cord dropped, where you'll be pushed out of the way. If you're not being pushed out of the way, you're not involved enough in that. The thing that most impressed me with students was really just interest, showing that they have thoughtful questions and that they're interested in the people and their life stories.
Leah, let's say that a medical student is on rotation with you, they're showing interest, they're going home, they're reading about the OB topics that you're seeing that day, about to see the next day. What source are you hoping that they're going to?
Case files. I thought case files was a really good resource.
Okay, great.
Blueprints is good, but it's almost too detailed for a medical student.
So let's say that you have a medical student who's going to rotate with you in reproductive endocrinology, and it's part of their third year clerkship. Maybe all they've seen is general OBGYN, and they're a little nervous about coming into the clinic for one of the subspecialties. What do you say to that student?
And just have an open mind and be ready to explore. It's going to be a totally different language than anything you've seen before. We don't expect you to understand it. We don't expect you to have knowledge of this area. For reproductive endocrinology, it's going to be a lot of shadowing. It's going to be a lot less hands-on than other things, just because the nature of the specialty. I would read up on the basics of IVF, know our basic medications. We use very few things. We use Clomid, we use letrozole, we use Lupron, we use FSH. That's about it.
What do you say to medical students about like the very sensitive nature of your practice?
These women and men are opening up to you at some of their most vulnerable. They say that having an infertility diagnosis from a psychological perspective can be as difficult as having a cancer diagnosis, because it's really going to change the trajectory of your life. So it's okay to be emotional as well for you. It's can be a difficult thing, especially if you're going through your own journey. And as so many of us are. I mean, 1 in 4 physicians have infertility. I myself have done IVF twice. So I think it's okay to empathize with your patients and really feel those things while you're here. And also, if any of your medical students ever want to talk about OB or REI, email me, Dr. Roberts, DRROBERTS at bocafertility.com. I'm always happy to talk to people and mentor people going forwards.
Awesome. Thank you so much, Leah. I really appreciate you taking the time and being available. It means a lot to me, and I know it'll mean a lot to our students too.